Well, I wrote the newsletter for February about how to make a killing, how to tap into the pot of gold. Uh, I get this question all the time from diabetic, chiropractic, medical students, even pharmacists, et cetera. They ask me, look, I'm tired of being in a business that by and large does no good, costs criminal amounts of money, and the patients never get better. And this is the business of treating people with Western diseases with pills and surgeries. And what I'm talking about is, pretty much everything your friends and relatives have. We're talking about obesity and coronary artery disease and breast cancer and colon cancer and type 2 diabetes and inflammatory arthritis and so on. Your patients never get better. My patients get better. So people see that. It's because of a change in diet. You can learn about that diet easily. It's free, easily accessible on the website. So people learn this, and they want just as rewarding of a career as Mary and I have. And they always ask me, well, how do I do this? And plus, we take care of medical students from all over the world. We offer them the opportunity to learn from us. We'll have medical students starting tomorrow with a 10-day program. And they find their way because they pretty much discovered the truth about big med, big farm, big food, so on. So they're there to kind of get everything in line. They're usually third, fourth year medical students, or we also take residents in training. We don't take already licensed practitioners. You've had your shot. You can pay the money and learn from our website. But we take these students for free. In fact, we pay all their expenses, including travel expenses. But they're always asking me, these students and students prior to this amount of education, they say, what am I going to do? How am I going to go to medical school or dietetic school, and how am I going to get through it? First of all, knowing what I know. And my answer is clearly, shut up. Don't say anything. You don't want to challenge your professors. You're just asking for trouble. You need to go along during this training. And then they ask me, well, how do I make money when I get out? And that of course, is the challenge. And I address that in this newsletter, how to make real money by doing diet therapy. The way I look at it is this, and I would like those of you who are patients, practitioners, those of you who are company owners and are paying for healthcare, anybody out there, let's look at this from another point of view. And that is, we have a huge sickness business. Huge. I mean, of the 330 million people in the U.S., at least 80% of them are sick from dietary diseases. There's $3 trillion a year, 3 trillion. I can't even imagine what that means. $3 trillion a year spent in the U.S. on healthcare. It's 17% of our gross national product. Well, this huge business of heart disease and diabetes and obesity and constipation, it's only been tapped into, in my experience of 50 years, it's only been tapped into by the drug companies, the device companies, the hospitals, the medical doctors, the naturopaths pushing supplements. They're the only ones, the surgeons, et cetera, they're the only ones that have tapped into this big pot of gold. Excuse me, $3 trillion, and most of it is available to you as a practitioner of diet therapy. If you can build a better mousetrap, well, we have the better mousetrap. You just have to go to work, as well as I have, and some other doctors are going to work. You just have to go to work and find out how to take the business. These are sick people wanting to get better. You have the secret on how to get them better. They don't. The cardiologists don't. The oncologists don't. The diabetologists fail. So here, start looking at the world from this point of view. There's this big pot of gold, and it's yours for the taking. You just have to get in there and take that share of business away from the heart surgeons, or the prescribers of diabetic pills, or the prescribers of biologic agents for arthritis and other autoimmune diseases. Just go in there and grab that pot of gold and take it home, and you can buy the fanciest cars in the neighborhood and have the biggest houses for your family and pay for your kids and your education and put shoes on the kids and send them to the best private schools. you deserve to do that because of your therapy. I mean, your therapy is what really works. That other therapy that they give, the drugs, the surgeries, the radiations, the devices for chronic disease, in large part, they fail. I could go through exceptions like hip replacement. But by and large, we're competing with an industry that has a reputation for solid failure when it comes to chronic disease. So that's what I wrote the newsletter about, some of the suggestions I gave those of you studying in this field of diet therapy. That means preventing and curing diseases like coronary artery disease, type 2 diabetes, which is always curable, inflammatory arthritis like rheumatoid arthritis, which is almost always curable. That's diet therapy. And I teach you how to do that free on the website. And there's also a couple of courses that I have. One a CEU approved, that's approved for nurses and probably dietitians and other people that can get CEU credit. And then I have a CME class, which is approved by physicians. And these would be MDs, DOs, et cetera. So you can get CEU and CME credit from a couple of courses I taught. So, okay, once you get a degree, which I encourage all of you to do, all of you listening to me that want to go into this kind of healthcare, first get a degree, become a registered nurse or a registered dietitian or a medical doctor or a doctor of osteopathy or a chiropractor or a naturopath. Get yourself a license that says that you've gone through a certain amount of credible training. It's really important. That way, patients and colleagues can look at you and can say, well, this person is a real healthcare professional. They have certification of that from the state, from a licensing board. So start there. As I say, when you're in your training for these credentials, your mentors don't want to hear that what they're doing is wrong and that you have a better way. But once you get your certificate, then speak up. They can't take it away from you. Somebody said they were worried about their license if they do this. Well, you're not going to lose your license if you do the right thing. I mean, you may lose your opportunity to train because you're held to no standards except for what your mentors seem to be correct. So they can throw you out. Your teachers can throw you out. Your professors can throw you out. But once you get credentialed, you get a license that says you know everything a registered dietitian knows or a medical doctor knows or a chiropractic doctor knows. Once you get that certification, they can't take that away from you. They can take your license to practice away from you. But to do that, they would have to be justified. And practicing dietary therapy is the highest of all therapies in terms of patient benefit, in terms of cost effectiveness, the highest of all therapies available for chronic disease. So anyway, you get your degree, you certification, then you learn about dietary therapy, which I've taken the trouble to explain to you. You can learn from other people, but I don't agree with most of the approaches out there. They consider diet therapy pushing a bunch of supplements on you. And then you go find yourself a job. Now, where do you find a job? Well, you could go work for a cardiologist or a diabetologist or an oncologist or all kinds of established physician practices you could join. Then you join this man or woman with established practice, and you teach the people what really works, and that is to fix the food poisoning. And then what happens is this cardiologist, diabetologist, oncologist looks like the best doctor in town because his or her patients, unlike the other professionals, his or her patients get well. So that's one way to do it. Another way to do it would be to join medical groups. Medical insurance companies should be interested. Medical groups should be interested, particularly, well, they aren't now because they get paid fee for service. Unit value, relative unit value. In other words, people get paid in medical groups now for doing more. The more you do, the more money you make. So the big medical groups in your town, they have all kinds of tests available that they can run. They'll take and ping pong you from one doctor to the next so that they can squeeze as much money out of you as they can. In other words, you come in with, say, a little chest pain. They first, you see the family doctor, then he or she refers you to the cardiologist. And once they find it isn't cardiac, they refer you to the gastroenterologist, and he or she makes her bucks off you. And then they refer you to the rheumatologist, the bone doctors, and they find out it's not your bones. And then as a last resort, to dig the last bit of money out of you and to not admit guilt that they don't know what's wrong with you, how to fix you, what they do is they send you to the psychiatrist or psychologist. And this person blames your problems on you and gets you hooked on some antidepressant drugs, painkillers, etc. And then you're forever tied to the medical group. Anyway, that's the way the medical group works under fee-for-service right now, most of them. There are exceptions. I pointed out Kaiser Permanente, but I got some criticism for that. And I won't go into details about Kaiser's practice, but it still is my great hope that Kaiser is incentivized to do the right thing. Anyway, you go to one of these groups and you say, look, Kaiser would be a great place, the obvious place to start. But another group would say, look, this system of paying for doctors and dietitians and other medical people to do things to patients is passing. We have a new system out there called capitation. It's not really new. It was tried 20 years ago. And this is a system where the insurance company, and this may be the government, pays the medical group or the doctor X number of dollars to take care of the patients. And you can make money by cheating patients on necessary care. That's one way to do it. But the right way to do it would be to get the patient well. So say you get $10,000 for a patient, and you can cause that patient to not need any care by getting them well. You get to keep the $10,000. Cool, huh? This capitated system is set up to take into account how sick people are. In other words, if you get really sick people that are, say, costing $100,000 a year, they're not just going to give you $10,000 for that patient. They're going to give you a lot of bucks. Well, for these really sick people who you can make really well, we get, as we've published, we get close to 90% of people to reduce or stop all their diabetic pills and blood pressure medications. We get them well. So here, just say who's ever controlling capitation decides that I get $50,000 for each one of my patients, because my patients that I take care of, the people starting tomorrow, good share of probably cost $50,000 a year. Well, if I can make them well, which we do almost every time, and you can too, and you can do it within a medical group, within a university, within an individual practice setting, under capitation, then you can make that particular group, university, or individual practitioner just the wealthiest in town, because they collect premiums and don't have to pay it out. And then there's one third suggestion I gave in that February newsletter that came out March 1st, 2017, is that it's for you to approach companies, big businesses like Ford Motor Company and IBM, or small businesses. We are involved with 2 businesses now. And to take care of their employees, self-insured businesses in particular. And most businesses are eventually self-insured in one way or another, even if they have to go through an insurance company. They pay for sick employees in lots of ways. Employees are very expensive to replace. A company, $1 million or $2 million to replace a key employee easily. So you don't want them to be sick. So you tell the company, look, I can save you your key employees. And then you say, I can also cut your healthcare costs, which we've done for 2 multi-billion-dollar a year companies. We've done this over the last several years and proved that we can reduce their healthcare costs. I'll just give you an example. Our last program for a big telecommunication company had 120 people in it. And not only did we educate those 120 people, and like I say, we took nearly 90% of them off all their diabetic and blood pressure pills, or reduced those pills, and gave them great health. We've had feedback from people who've gone through that program and the one before, showing that they lost 60 pounds, gotten off all their arthritis medicines, lost 120 pounds, etc. So you change those 120 people plus all the people they work with. It becomes infectious in a company for the employees to start becoming well through a good diet. Well, what I pointed out in the newsletter, and I want to point out to you, and you should tell any company you know, this very simple to see fact. And that is, for us to take care of 120 people for 8 days, an 8-day program, the total cost to this company for these 120 people who infected thousands of people in their company, the total cost was less than 3 heart surgeries gone well. It's less than 1 heart surgery with major complications, which is everyday outcome is heart surgery with major complication. So there's not a medium or big company that I can imagine that exists in any Western society that hasn't been hurt financially in many ways, but in particular having to pay a hospital bill of $1 million for one patient. And we can educate 120 people for half that much.